Are sex and gender different? Can someone identify as more than one gender? What about identifying as not having a gender? In the past, the terms sex and gender were interchangeable. They were used as one and the same because there was no need for any distinction between the two. There were only two genders or sexes someone could be given, and that was either a male or a female. Now, in 2021, that has changed dramatically. The term sex is a label given to an individual at birth. This label is based upon the person's genitalia, internal sex organs, specific hormone levels, and their genetic makeup, more specifically their chromosomes. Gender has developed a much broader definition. From gender roles to gender identity, many have pushed away the typical social norms that are assigned to them via society or their culture. As a respiratory therapist, it is important to give everyone the respect they deserve, no matter what gender they choose to identify with. In most healthcare situations, the gender identity and sex of a person does not matter. Therefore, their identity will not impede with their care. But in some cases, such as an intubation or a pulmonary function test, their sex is needed to give proper care as calculations will be based on their anatomy. This can be difficult to explain to a patient, especially since many are still often discriminated against due to their gender identity. The first step is to assure them that they are not being judged. An explanation should be factual and without bias or prejudice. The reason why is it important to treat their sex and not their gender is that treatments are set to the specific genetic makeup and anatomy of the body. The best example is that males typically have larger or wider lungs, meanwhile females typically have longer lungs. This genetic makeup even goes to race, as the anatomy of the lungs differ in each race, and that must also be added into the calculations. It is important to stress that as an RT, needing to treat the sex of a patient and not their gender identity does not mean we are demeaning or judging them. If the sex of a person is not treated, then it can lead to complications such as improper diagnosis from the pulmonary function tests, or if a person is intubated, they will receive improper ventilator settings, which can cause trauma, like a pneumothorax, to the lungs due to inadequate volumes that are given. Due to the harshness of the LGBTQ community still faces today, many do not seek healthcare for fear of discrimination and poor treatment because of their gender identity. Therefore, it is imperative to realize and assure them that their gender identity does not, should not, and will not affect the quality of care that they receive. When explaining to a patient the reason their sex is needed, the patient may get defensive and argumentative. For many, the journey through finding their gender identity may have been so traumatic, so the thought of having the label they've separated themselves from can bring back horrible memories. The best way to handle a situation like this is to be honest about why you are asking the questions. Adding reasoning and being compassionate can sway a patient who is on the defensive to realize that you are there to help them and not judge them. The best way to ensure that you are giving adequate care is to ask them what pronouns they wish to be called, explain the procedure or treatment, and answer any questions or concerns they may have. Educating yourself on different gender identities can be as simple as doing a quick Google search or asking the patient themselves to explain to you if you don't understand. There is nothing wrong with having a respectful and educational conversation. Lastly, for individuals who have gone through a sex change, it is important to remind them to stay up to date for their doctor's appointments to make sure that they are staying healthy. As an RT, the medications they are on will not affect treatments given by your department. However, it may be a good idea to pay attention for any allergic reactions or change in behavior the patient may be having, as this could be a sign of an adverse reaction to the combined medications. Respect and compassion are important factors in healthcare, and just because someone identifies with a different gender does not mean that they do not deserve respect. The LGBTQ community are slowly receiving the rights that they deserve, and it is great that the world is progressing. We as healthcare workers can help get rid of the stigma in healthcare against the LGBT community by continuing good healthcare practice and showing them respect.